Welcome to today's presentation. So, what exactly is vitamin E? Well, it actually refers to a group of 8 different compounds that are fat-soluble. These compounds are mainly divided into 2 categories, tocopherols and tocotrienols. Each of these categories includes 4 types: alpha, beta, gamma, and delta. Among all of these, alpha tocopherol is considered the most biologically active form when it comes to human health. Now, the primary role of vitamin E is acting as an antioxidant. That means it helps protect our cells from damage caused by free radicals, which are unstable molecules that can harm our cells and contribute to aging and various diseases. Understanding this helps us see how vitamin E fits into the bigger picture of maintaining overall health and preventing cellular damage. Let's explore the biological importance of this compound and how it benefits our health. First, its antioxidant function is crucial. It helps prevent oxidative stress and protects our cell membranes from damage, which is fundamental in maintaining overall cellular health. Next, it plays a significant role in supporting our immune system by enhancing immune responses, making us better equipped to fight off infections. When it comes to skin health, this compound promotes healing, reduces scarring, and even offers some protection against UV damage, contributing to healthier, more resilient skin. It also has an anti-inflammatory role, helping to reduce chronic inflammation, which is linked to many diseases, including heart disease and diabetes. Lastly, there's a strong connection to neurological health. This compound helps protect nerve cells, and studies suggest it may be linked to a reduced risk of cognitive decline as we age. Overall, these functions highlight how vital this compound is, not just for individual systems, but for supporting our overall health and well-being. Now, let's take a look at some of the rich natural sources of vitamin E. You'll find that nuts and seeds are particularly good options, with almonds, sunflower seeds, and hazelnuts all packing a healthy dose. When it comes to vegetable oils, sunflower, safflower, wheat germ, and olive oil are excellent choices to include in your diet. Vegetables like spinach, Swiss chard, and broccoli also contribute to your vitamin E intake, offering additional health benefits. Fruits such as avocado, kiwi, and mango are not only delicious, but also provide this important nutrient. And don't forget about fortified foods. Many breakfast cereals and margarine are enriched with vitamin E, making it easier to meet your daily needs. It's important to remember, however, that cooking and storage can influence the vitamin E content in these foods. Proper handling and preparation help preserve this vital nutrient, which plays a key role in supporting your overall health. Integrating a variety of these sources into your diet ensures you get enough vitamin E to support your body's functions. Let's take a closer look at the recommended dietary allowance, or RDA, for vitamin D across different life stages. As you can see, for infants from 0 to 6 months, the RDA is about 4 milligrams per day, which is equivalent to roughly 6 international units. Moving on to young children aged 1 to 3 years, the requirement increases slightly to 6 milligrams, or about 9 IU per day. When we reach adolescence, specifically between 14 and 18 years, the RDA jumps to 15 milligrams, which translates to 22 IU daily. For adults, the recommended intake remains at 15 milligrams or 22 IU per day, emphasizing the importance of maintaining adequate levels throughout adulthood. Pregnant women are advised to consume the same amount as non-pregnant adults, 15 milligrams or 22 IU, highlighting that pregnancy doesn't change the basic vitamin D needs. However, during lactation, the RDA increases slightly to 19 milligrams or about 28 IU per day, reflecting the additional nutritional demands of breastfeeding. Overall, this table underscores how vitamin D needs vary depending on age and physiological states, which connects back to our overall theme of ensuring proper nutrition for different stages of life. It's crucial to meet these RDAs to support bone health, immune function, and overall well-being. Now, let's talk about the signs and causes of vitamin E deficiency. First, one of the main causes is fat malabsorption, which can happen in conditions like cystic fibrosis or Crohn's disease. When fats aren't properly absorbed, vitamin E, being fat-soluble, also can't be absorbed effectively. There are also genetic disorders that affect how vitamin E is transported in the body, making deficiency more likely in those cases. Moving on to symptoms, vitamin E deficiency often presents with muscle weakness and coordination problems, which is known as ataxia. You might also notice deterioration in vision over time. Some individuals experience tingling or numbness in their extremities, a condition called peripheral neuropathy. Additionally, a weakened immune response can make it harder for the body to fight off infections. In infants, retinopathy, which involves damage to the retina, can occur due to deficiency. Overall, these signs highlight how essential vitamin E is for maintaining nerve health, immune function, and vision. Recognizing these symptoms can help us identify deficiency early and address the underlying causes effectively. Let's talk about supplementation and dosage. Vitamin E is commonly available in two forms: D-alpha-tocopherol, which is the natural form, and D-alpha-tocopherol, the synthetic version. Both are used to provide the benefits of vitamin E, but they differ slightly in origin and sometimes in potency. You'll find that supplements are often used in specific groups, such as premature infants, who need extra support for development, or individuals with fat absorption issues, since vitamin E is fat-soluble and relies on proper fat absorption to be effective. Additionally, vitamin E is popular in skin and beauty applications, thanks to its antioxidant properties that help protect and improve skin health. However, I want to emphasize a word of caution here. Excessive supplementation can lead to interactions, especially with medications like anticoagulants. This could increase the risk of bleeding, so it's important to use supplements responsibly and consult with healthcare providers if you're on medication or have health concerns. Overall, understanding the proper dosage and the specific needs of different groups helps us use vitamin E safely and effectively as part of a balanced health approach. Now let's talk about vitamin E toxicity. The upper tolerable intake level, or UL, for vitamin E is set at 1,000 milligrams per day, which is equivalent to about 1,500 IU. Exceeding this amount can lead to some adverse effects. One of the main concerns with too much vitamin E is an increased risk of bleeding. This happens because vitamin E can interfere with blood clotting, which is especially important to keep in mind if you're on blood-thinning medications or have bleeding disorders. Other symptoms of toxicity include nausea, diarrhea, and stomach cramps. Some people might also experience fatigue or blurred vision if they consume too much vitamin E. It's also worth noting that excessive vitamin E intake may counteract the role of vitamin K in blood clotting. Since vitamin K is vital for proper blood clot formation, high doses of vitamin E can disrupt this balance, increasing the risk of bleeding issues. So, while vitamin E is essential for health, moderation is key to avoid these potential toxic effects and maintain overall balance in your nutrient intake. On this slide, we're looking at the diverse applications of our topic in health and industry. Starting with medical applications, it's exciting to see ongoing studies focused on neurological protection, especially for conditions like Alzheimer's and Parkinson's. While these studies are still in progress, they hold promising potential for future therapies. Another important area is slowing down age-related macular degeneration, which can significantly impact vision as we age. Plus, there's growing evidence supporting its role in maintaining liver health, which is vital for overall well-being. Moving on to cosmetic and skincare uses, you'll find this ingredient in many everyday products like moisturizers, sunscreens, and anti-aging creams. Its ability to reduce UV damage, keep skin hydrated, and promote healing makes it a valuable component in skincare routines. Finally, in industrial applications, it's used as a food preservative. Thanks to its antioxidant properties, it helps extend the shelf life of various food products, ensuring they stay fresh longer. Overall, these applications highlight how versatile this compound is across different fields, from health to industry, connecting back to our overall theme of innovative and beneficial uses. Let's talk about vitamin E and its connection to chronic disease. When it comes to heart disease, the evidence is actually quite mixed. Some studies suggest it might help, while others show no clear benefit, so it's not a definitive preventive measure. Moving on to cancer prevention, the evidence is limited. In fact, taking high doses of vitamin E may not always be beneficial and could even be harmful in some cases. However, when we consider eye health, vitamin E appears to support our vision and may help slow the formation of cataracts, which is quite encouraging. Lastly, there's some promising research on cognitive function. Vitamin E might help slow the progression of Alzheimer's, especially in older adults who have low levels of the vitamin. Overall, while vitamin E has some potential benefits, especially for eye health and cognitive support, its role in preventing heart disease and cancer isn't entirely clear-cut. It's important to consider these nuances as we think about how this vitamin fits into a healthy lifestyle. Let's take a closer look at how vitamin E compares to other antioxidants. As you can see, vitamin E has a high antioxidant strength, which mainly comes from its ability to protect cell membranes that are rich in fats. This is crucial because fats are particularly vulnerable to oxidative damage. In comparison, vitamin C has a moderate antioxidant strength and is water-soluble, meaning it operates mostly in the watery parts of our cells. Interestingly, vitamin C also helps regenerate vitamin E, boosting its antioxidant capacity. Selenium, on the other hand, plays a supportive role. It acts as a cofactor for certain antioxidant enzymes, helping them do their job more efficiently. Finally, beta-carotene has a moderate antioxidant strength too. It's not only a precursor to vitamin A, which is vital for vision and immune function, but also acts directly as an antioxidant itself. Understanding these differences helps us see how each nutrient contributes uniquely to protecting our body from oxidative stress, fitting into the bigger picture of maintaining overall health. Let's wrap up with a quick summary of what we've covered. This essential fat-soluble nutrient is known for its powerful antioxidant effects, which help protect our cells from damage. You'll find it in a variety of natural foods, especially nuts and oils, making it relatively easy to include in a balanced diet. This nutrient plays several important roles in our body, including supporting our immune system, maintaining healthy skin, and even helping prevent certain chronic diseases. It's safe to consume in recommended amounts, but it's important to remember that taking too much can pose health risks, so moderation is key. Finally, while a balanced diet usually provides enough, supplements can be useful when dietary intake is insufficient or in specific medical conditions. Overall, understanding this nutrient helps us appreciate how vital proper nutrition is for maintaining our health and well-being. And that brings us to our references. I want to acknowledge some key sources that have informed this presentation. First, the NIH Office of Dietary Supplements, which provides authoritative information on supplements and nutrition. Then, the World Health Organization, whose global health guidelines help shape our understanding. We also relied on insights from the Mayo Clinic, known for their comprehensive medical expertise. Additionally, PubMed research articles were invaluable for the scientific evidence backing our discussion. The Linus Pauling Institute at Oregon State University also contributed important research, especially on micronutrients and health. And finally, I want to thank you all for your attention and engagement. These sources collectively underscore the importance of evidence-based information and help us stay informed about best practices in health and nutrition.